Do you have chronic pain? Do you have recurring injuries that just keep happening? Or maybe you have arthritis, a pain that keeps getting in between you and the things you love to do? Today I'd love to talk about some of my top tips to help you get past those, potentially to help you heal faster, and to help you get back to those things that you love doing. My name is Dr. MacMillan. I'm a naturopathic physician, and a big part of my focus is on sports medicine, chronic pain, and injuries. So this is a big part of what I talk about with many of my people, and I hope to help you here today with this video. Tip number one, super simple, is movement. We need to move to feed the tissues. So for example, if I hurt my elbow, I can't just immobilize and hold my elbow still. It will gradually break down. I will lose muscle. I will lose connective tissues. Even the joint itself will start to fall apart. Even the bones will slowly start to degrade. We need to keep moving them. So I need to find exactly where I can move pain-free, what kind of motion I do have, and I need to challenge that. I do need to actually move through it. Which brings me to my next tip. Pain. Pain should be respected, but challenged. We need to know where that pain happens. So if I can extend my arm, for example, up to this point and then I hit a wall, if this is where it hurts, today this might be my stopping point. But over time, I need to continue challenging that. I need to continue following that pain wall because we expect you to heal and we expect that wall to move. You need to know when that wall moves so that you can help it to get better. So over time, I might find I can actually move quite a bit further. So the movements that I do when I actually breathe some life back into this joint, I need to know that now I can move further. I can use this arm just a little bit more. My third tip is keep yourself healthy enough so that you can actually heal. A lot of people go wrong with this, especially with sleep. We release a lot of growth hormones and a lot of our growth factors at night while we're asleep. What this means is if we're not actually sleeping, we're not actually healing, and we can't put those tissues back together again. I'll say that again, we need to sleep well to actually heal, so it's something that I recommend focusing on. If you're having trouble sleeping because of pain, this is a golden point for potential pain medications to help you to sleep through that. Ideally, we get you into a nice safe position first, and then we give you a little bit of something to help you sleep through the night so that you can actually heal and decrease that pain a little bit faster, because waking up through the night doesn't help anyone, and you don't need to suffer for no good reason. So, as a naturopathic physician, I can add to this. I often test for things like iron levels, I test for thyroid hormones, I test for the healing hormones, including testosterone. We want to be sure that everything in the background is also working to your benefit to help you put it back together and to help you to heal. Sometimes the barriers between us and our goals are things we can't see very easily, and that's part of what I help people to find. But first, keep moving it, because that helps most people. It really helps most people. Keep challenging it and finding that pain point, because you need to know where that is, and you need to know that you're progressing forward, and you need to grow with that. And third, take care of yourself and try to get more sleep. Do everything you can to get around 8 hours. We can prove now that most of us need about that. People don't do well in 5 hours, despite what we like to believe ourselves. For more information, feel free to visit the BCNA website and learn more about us and what we do. Thanks so much.